Today I want to talk about the impact of cervical restorations. This video is for dentists and patients alike. I always wanted to help my patients understand the importance of good plaque control and the potential impact that certain restorations may have on the health of your gums, of the periodontal tissues. So I will be using terms that both dentists and patients can understand better. For the last 26 plus years, I've seen the progress of periodontal health in patients that I've been able to follow up. And I have seen how many of them presented with gum recessions, gingival recessions, that would progress over the time. One of the identifying factors that impact the progression of those gum recessions is the presence of cervical restorations. That is fillings or restorations, crowns that have been placed on the exposed roots, on those areas that presented with gum recession, with gingival recession. Individuals 18 years of age and above are likely to have at least one tooth with a gingival recession. We're going to see this 50% of the time, and the older the individual gets, the more exposure to trauma. So as a result, we are more likely to see more recessions as we age. And at this point, I want to make it clear that the recessions are trauma-induced, and the factors that leads to the presence and progression of a recession, incorrect or aggressive tooth brushing, and that is self-induced. But not always a recession can be caused by brushing too hard. There are other forms of trauma, such as excessive orthodontic forces, for example. The main reason that I wanted to do this video is to make our patients and dentists understand the potential negative effects, the negative impact of cervical restorations, that is class 5 composites, resin bonded restorations, and fillings, white fillings on the exposed roots. The other main reason we may see receding gums is periodontal disease or gum disease. Patients with periodontal disease have bone loss, and so when there is bone loss, we're going to see receding gums as well. It is quite common. So our focus today is on trauma-induced gingival recessions and why they happen, how we can prevent it. So when we see a progressing recession, gum recession, we want to try to avoid filling that exposed root with a resin bonded restoration or a crown. We want to give a chance to that exposed root to be covered again, and we can do this. There are means of doing this. We can cover that root again with a gum graft. We can protect the exposed root with the tissue that belongs to that area, which is the patient's own gum tissue, rather than placing a filling, a restoration, a crown over that exposed root. We want to minimize the progression of that recession by correcting that progressing recession with a gum graft, with a connective tissue graft. And this will provide better stability and health, overall health, as well as aesthetics to that site that keeps on getting worse and worse. I can't tell you how many progressing recessions I have seen throughout the last 26 years. Recessions that were getting worse and worse as a result of the presence of a filling, of a resin bonded restoration right on top of the root, trying to minimize the possible sensitivity that that patient was having. So many general dentists like to restore those exposed roots with a restorative material, with a filling, a white filling, as opposed to proposing a gum graft to correct that recession. Remember, the tissue that belongs to that exposed root was the patient's gum tissue, not a restorative material, not a filling. You want to have on that exposed root gum again. If it's doable, you want to have a gum graft or that exposed root regenerated with your own tissue, with a gum tissue, as opposed to having a filling over it. We have long-term scientific data over 26 plus years follow-up showing exactly this. So basically this study showed on two different groups of patients, test and control. Control patients were those with no restorations, less than 1 millimeters of gingival. This scientific data has shown that there is an impact, a negative impact of the presence of restorations that are too close to the gum line or under the gum line, that is subgingival. Basically, there are restorations that were under the gum line presented two main things: more inflammation, that is bleeding, and more attachment loss, that is recession over the long term. And so in this study, they follow over 200 patients for over 26 years, those that had restorations too deep under the gum line and those that had a restoration that was away from the gum line or right at the gum line. Basically, those that had restorations, fillings under the gum line, more than 1 millimeter under the gum line, were showing, again, these two things: more inflammation and more attachment loss or recession over the follow-up period of time. And so basically the conclusions, the bottom line is that restorations that are under the gum line will definitely lead to this type of complications. Again, whenever possible, we want to have that exposed root, that recession area, covered, treated, corrected with a gingival graft, with a gum graft, as opposed to having a restorative material, whether a filling, a resin bonded, or a crown, sitting over the exposed root. We would like to treat that recession first, and if a restoration is needed afterwards for an abstraction, for example, or an abrasion that many times happen at the cervical area, that can be done later on by the restorative dentist. Just think about this for a minute. The materials that are used, the filling materials, the resin bonded restorations that are used to fill, to restore decay, carious lesions, have a completely different coefficient of compression and expansion. What does this mean? This means that in the presence of cervical, of temperature changes, like for example, or cold, which our oral cavity constantly has when we drink a cold glass of water or a hot tea, we're going to see a compression and expansion that is constantly happening in our oral cavity. The environment inside the mouth is actually quite harsh. It's not easy to put up to cope with the constant changes that we have when we eat or drink this and that. So that coefficient of compression and expansion is completely different from the oral tissues, from the enamel and the dentin and the cementum that are the main components of our teeth. So that discrepancy between compression and expansion is going to lead to discrepancies in the marginal areas where the filling material is sitting over that exposed root, and that will cause the potential leakage and the presence of inflammation because of the creation of micro cracks and micro gaps in between the filling material and the exposed root. So my recommendation is please ask your dentist before they offer you the option of a wide filling over that exposed root or that recession area. Placing these type of fillings or restorations over exposed roots may have a negative impact on the health of your gums and may actually lead to more recession over the time that will be more difficult to treat. These are different patients that I treated over the time or the years. Some of them actually were having this issue with the last 5 composites. Again, those fillings that our dentists like to place on the roots when the gum recedes. And so over the time, there are a number of patients that saw that their gums were getting worse, they were having more recession when those fillings were placed over the root. And many patients didn't know that they could have those long teeth, those recessions, treated with a gum graft, which is the standard of care when it comes to areas that present progressing attachment loss, progressing recession. Ask your dentist before or if they offer you the option of filling a root with a restorative material. Ask your dentist if a gum graft is the right thing for you. This other patient had a very high smile line, so she was showing the recessions, the progressive recessions that she had on both canines, and so she was concerned because she had some sensitivity on those exposed roots and was asking whether or not a filling material or restorative material would be the right choice. After examining the patient, we informed her that a gum graft was indicated. It would be the best option to treat her receding gums. The gum grafting was done. It was very straightforward, and the patient was very happy 8 years after, with a very stable condition and a high smile line that is definitely more good looking now that we have been able to cover those receding gums. This other patient had a caries, a decay on the exposed root, together with a recession, and so she was asking if a filling material would be the right choice to fill the cavity space. So this can be easily treated. We can remove the decay and fill that space not with a filling material but with the patient's own tissue, the gum. We can correct that receding area with a gum graft and fill the area with her own tissue rather than doing a filling, a restorative class 5 restoration. This other patient, the same tooth, same canine on the right side, presented the typical scenario of self-induced. He was brushing really hard, and so he caused a progression recession. Over the years, the patient had a number of restorative materials, class 5 restorations, done over that root that kept falling and falling. The patient was unhappy with the restorative option and decided to seek advice. In this case, it was clearly indicated also the use of a gum graft to correct the progression recession, as opposed to placing again another restorative material that would have a similar fate. After 3 years, the gum grafted area looks outstanding with healthy gingival margins. The patient was very happy and decided not to do any any restoration over the area over the crown that still presented a slight dip on the enamel. But he definitely changed his oral habits and started to brush his teeth more gently. We gave him some oral hygiene instructions to prevent further abrasion of the tooth structure. This is another case presenting advanced gingival recessions, severe attachment loss on multiple teeth. The patient, as you can see, has multiple restorations, class 5, those cervical restorations. And if you pay attention, especially to the canine on the right, that particular tooth has the greatest amount of attachment loss of recession, and is precisely the area where the general dentist kept doing filling over and over again, and the roots, basically the gum, kept on receding over the years. So notice again that those areas where you see class 5 cervical restorations, fillings over the roots, are the ones that present more progression recessions, gum recessions, because of the presence of that filling, that basically the gum is running away constantly all the time, running away from that restorative margin. Gum tissues don't like those restorative margins. Again, remember the study that we quoted earlier. We're going to see more inflammation, more bleeding, and more recession, attachment loss on those roots, exposed roots that have restorative materials. This is perhaps a more complex case because the patient had Xerostomia or reduced salivary flow, which can lead to the formation of new caries, and decay is more likely to happen on patients that don't have good salivary flow. So caries control is a key aspect on these patients that present low salivary flow or xerostomia. We can still definitely do some gum grafting to correct those progressing recessions and help those gingival margins, those gum areas, stay healthier over the time. We saw this particular patient 6 years after we had done the treatment. She was lost during the pandemic time, and so when we saw her back for follow-up and evaluation of those areas, specifically the site that presented the greatest amount of attachment loss of recession had responded beautifully to the gum grafting that we did. However, the cervical area where the dentist had placed a filling material had fallen again, and the patient had to go back to the restorative dentist to treat it. Other than that, the root coverage was 100% and very stable. And I have to say that it's not easy to achieve, to do a good restorative work, especially when dentists are working close to the neck of the tooth, the cervical area. And so this is what may happen as a result. Those white fillings may fall. One of my recommendations is to, when those restorations are done, is to have them highly polished, which is, I understand that is difficult. So sometimes we decide to do these class 5 restorations prior to the gum grafting procedure. That way the dentist can polish the cervical area much better. When those restorations are done prior to gum grafting, they should be right at the cervical enamel junction, not above. And they should be coordinated with the periodontist, the person doing the gum grafting, so that they both the general dentist and the periodontist have a good understanding of where they are going. This is another patient susceptible to caries, to decay, and so she had also very thin tissue, very thin biotype, which led to recessions. And so the patient was presenting cervical lesions, cervical caries, again and again on a number of teeth. These two mandibular canines both had cervical lesions, caries that were treated. One of them was treated by the dentist, the other one, canine on the left, was not. So when we saw the patient, we informed her that we could correct those areas, those receding spots on both canines with a gum graft. So that's what we did. On the canine on the left, we eliminated, we removed the decay and did a coronally advanced flap with a connective tissue graft to correct that decay area. So the filling material for that root was actually the connective tissue graft, the patient's own tissue, not a filling. We were able to achieve 100% root coverage on that side. The patient was very happy. And on the other canine, on the canine on the right, the patient had already a white filling material, a resin bonded restoration that was partially removed up to the CEJ. Instead of doing any other filling again, the exposed root was corrected, was treated with a gum graft, and we were able to achieve also 100% root coverage. And the gingival margins look stable, healthy, and good looking after 25 months. These lower mandibular cases are perhaps more difficult to treat because of the muscle pull, the frenums that sometimes we find, and the very short vestibule that we may find as well. So it is more difficult to treat because of anatomical reason. And because of that, we see sometimes more relapse. So we have to do a better follow-up to see if any further treatment is necessary. In this case, the patient was able to implement good oral hygiene, and recessions were not present after the period of time that we follow her. Oral hygiene instructions are key to make sure that the patient understands how to brush those potentially receding areas, those areas with thin tissue, and make sure that either an existing recession does not keep on progressing, or an area that has been grafted with a gum graft does not get a relapse. We can definitely prevent a relapse of those receding areas when the patient understands how to properly brush. I have treated many of these cases over the years, over the last 26 plus years, and I have seen the beautiful aesthetic clinical outcomes that we can get when we do a gum graft procedure that is well done. We can definitely gain. We are basically gaining attachment, correcting that progression recession with the patient's own tissue that will keep getting worse if not treated, especially when there is lack of keratinized tissue. So the gum grafts provide, again, root coverage for those progressing recessions, gain in attachment, aesthetics, and we can oftentimes eliminate the sensitivity that many patients have when those roots are exposed. Unfortunately, many dentists and patients are not fully aware of the benefits of gum grafting, especially on aesthetic areas. Basically keep getting worse. The anterior teeth, the teeth on the front, both upper and lower, have a more fragile foundation. So those are the teeth that we usually see more progressing recessions. If you are a patient that presents gum recessions and want more information, ask your dentist. He will explain you the benefits long-term of these grafting procedures that have plenty of scientific data, scientific research that has been done on the clinical benefits and aesthetic outcomes that they can provide. We have recently published clinical data, long-term data on this type of procedures for aesthetic cases, anterior cases that we treated many years ago with a gum graft. And basically we have seen overall these gum grafting procedures provide healthy tissue stability long-term and gains in attachment. We can cover those roots. Each case is different and provide clinically aesthetic outcomes long-term. This new scientific evidence is going to be coming up. It's been published in the International Journal of Aesthetic Dentistry at the end of the year of this year 2025. The patients were asked about the perception of satisfactory aesthetics. They rated very high the gum grafting procedures. This study has solid clinical data and offers the perspective of the patient evaluating the aesthetic outcomes of these gum grafting procedures. By the way, if you like what you're hearing, please subscribe and more information will be coming up.